Welcome to the Endo Kids Podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsey Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. This podcast is for educational purposes only and is not a substitute for medical advice. Please consult your child's healthcare provider for individualized care. Welcome back to the Endo Kids Podcast, where little hormones meet big answers. I'm Dr. Rinku Mehra, a pediatric endocrinologist and founder of Endo Kids Concierge.
And I'm Dr. Lindsey Waldman, also a pediatric endocrinologist. Today, we're diving into a condition many parents hear about in adults, but may not realize can happen in children also: hyperthyroidism.
And we're going to walk you through what hyperthyroidism is, the signs parents should watch for, what causes it, how we diagnose it, and most importantly, what treatment looks like and what your child can expect.
Let's start with some basics. The thyroid is a small, butterfly-shaped gland in your child's neck. Even though it's tiny, it plays a huge role in controlling metabolism, growth, energy levels, mood, heart rate, really the body's entire speed setting.
Exactly. So before we talked about hypothyroidism or underactive thyroid. And if hypothyroidism slows everything down, it's like driving with a speed at 20 miles per hour. But hyperthyroidism is like being stuck at 80. Everything feels like it's speeding up.
Exactly. Kids may feel anxious, overwhelmed, overheated, or unusually energetic, but also strangely tired. It's a confusing mix, so we want parents to understand what's happening under the surface.
So let's talk about what causes hyperthyroidism in kids. The number one cause by far is what we call Graves' disease. And you may have heard this term. So Graves' disease is an autoimmune disorder where the immune system mistakenly stimulates the thyroid to make too much hormone.
Graves tends to show up in older children and teens, but younger children can get it too. And girls are more commonly affected than boys. There are some other less common causes of hyperthyroidism, and that includes thyroiditis, which is inflammation causing usually a temporary hormone release. You also can have over-medication with thyroid hormone. This is pretty rare. And then lastly, you can have a hyper-functioning thyroid nodule, which is also very rare in children.
But in pediatrics, Graves' disease is the biggest cause that we see and the one that we'll focus on.
Let's talk about some symptoms that parents should watch for. These symptoms can be sneaky or very dramatic. Some parents notice that their children's personality seems to shift. Other symptoms that you might see include weight loss, even though your child is eating well, feeling hot all of the time, a fast heartbeat or a pounding heart, shaky hands or a tremor, maybe trouble sleeping. They also can have some difficulty focusing in school, along with some anxiety or irritability. They can have more frequent stools, a really big appetite, of course, an enlarged thyroid. Again, that's in the neck, or tiredness, despite seeming very energetic or even wired.
Yeah, one of the most common thing parents tell me is my child isn't just acting like themselves. They can be a normally calm child and they can become anxious or a good student that suddenly can't focus.
Hyperthyroidism can get missed sometimes because these symptoms overlap with those of ADHD, anxiety, or even, quote, those typical teen mood changes we're all used to.
Yeah, and I can't tell you how many times in my practice I have seen kids who have been diagnosed with ADHD and have been treated with ADHD for many years. And actually, they had hyperthyroidism. And once we get the hyperthyroidism under control, their symptoms of ADHD improve dramatically. I don't know if you've had the same type of situation.
Absolutely. And because ADHD is very common, it is a common diagnosis, something that we see in pediatrics all the time. But if you're noticing multiple things, it never hurts in thinking about the thyroid.
Yes. And no, the question we get then is how do we diagnose hyperthyroidism? And the diagnosis is usually very clear to us as pediatric endocrinologists once we run the labs. And we check labs. So parents are often confused about the pattern of the labs that we see, but we check the TSH, which is called thyroid stimulating hormone, so TSH. And that, if you remember from our episode of hypothyroidism, is the signal from the brain. So that's the signal from the brain that tells the thyroid how much thyroid hormone to make. So we look at the TSH, we look at a free T4, which is the actual amount of hormone that the gland is making, and the total T3, sometimes we can check that also. But if we look at that pattern of TSH, free T4, those are the two that I usually run. And if I get a T3, I can look at that too. But usually the free T4, so the hormone that the gland actually makes, is very high. Okay. And what that signals to the brain is, hey, this gland is making way too much hormone. So the brain signals turn down like a thermostat. So in this situation, the free T4 is super high. If you think of it like a thermostat, like when you're hot in the summertime, you will turn down the thermostat, make yourself a little cooler. And so the TSH is turning down. Okay, so the TSH is low, the free T4 is usually high, and the total T3 is high too. And then we often get antibodies because, like we said, the most common reason is Graves' disease. And we will look at the antibodies for the thyroid, and often they're high in Graves' disease.
Absolutely. Sometimes we'll also do something called an ultrasound of the thyroid. Again, that's just in the base of the neck if we feel nodules or if the thyroid looks enlarged. It doesn't necessarily tell us anything different than the blood work, but it can give us more information.
Yes, most of the time, the labs alone give us the answer very quickly. But unless we feel the gland is very big or we feel some lumps or bumps, we may not even get an ultrasound in our pediatric population.
Once we have all of that information, we're able to think about and talk about potential treatment. And the great news here is that hyperthyroidism in kids is very treatable and manageable. The treatment options include number one, medication. That is the most common treatment in pediatrics. The medication we use is usually called methimazole, and it helps to slow down the thyroid and bring the hormone levels back to normal. There are some other options that we talk about in specific cases. One is called radioactive iodine therapy. That is much more common in adults or older teens. And then, of course, we have surgery. That's rarely needed, but it is an option when we're having a hard time controlling it with medication alone.
Most kids will start with medication and they do extremely well. Now, when you think about it, hyperthyroidism, the gland is overproducing hormone on its own. So, what we're trying to do with the medication is try to control the levels of the thyroid hormone. We monitor the labs pretty regularly and we adjust doses as needed. We will start your child on a medication and then monitor labs and adjust the doses as we need to get them to be in a normal range for their thyroid function.
Absolutely. And that can definitely take some time. Sometimes we need to go up, sometimes we need to go down, but checking those levels in the blood is the most important thing. And then parents a lot of times ask what they can expect long term, and they ask if their child will outgrow this condition. My answer is that some will, about 30 to 40% eventually go into remission.
Yes, and kids usually will feel much better once the treatment begins. So we help support them in school, their activities, and their daily routines as their energy levels normalize. But I will say it's a little annoying for the kids initially because we're getting the blood work frequently, but we do want to get their levels under control so that they start to feel better.
Absolutely. Now, Dr. Mehra, I have a few questions for you about hyperthyroidism. The first is hyperthyroidism dangerous?
So I will say if hyperthyroidism is untreated, it can cause strain on the heart. It can cause growth issues. Again, we talked about some of the other signs or symptoms. It can cause some weight loss, but really it's the heart that we worry about with hyperthyroidism is untreated. And so we do worry about that. But most of the time, when we catch it early, kids do very well. And even in extreme cases, when it's caught late, because I have had some cases where kids has not been recognized that they have hyperthyroidism and they end up in the hospital, those kids also do very well.
Absolutely. So here's another question for you. Will my child gain weight after treatment starts?
Yeah, so this is actually a very common question that I get all the time. If I treat hyperthyroidism, is my child going to gain weight? And so what I say to parents usually is, when your child is hyperthyroid, their metabolism really speeds up. Okay. It's like the gas pedal is really in overdrive and can lose weight and really they're really hungry. So everything that they eat really gets burned off because their metabolism is super high. When we treat hyperthyroidism, it's not the medication that's causing them to gain weight. It's really that we're normalizing their metabolism. So they may regain the weight that they lost. And also, the other point I want to make is if they keep eating the same way they were eating before, so if they develop that habit of overeating because they're just hungry all the time, they're going to gain weight even once their thyroid levels normalize. So we really have to be careful about that.
Absolutely. And my last question for you, can stress cause Graves?
So stress itself does not cause Graves' disease. Kids are stressed for so many different reasons, but it can intensify the symptoms that they have. Somebody who's hyperthyroid can be more anxious. They can be more nervous overall. They can be stressed out overall. But stress itself doesn't cause Graves' disease. So Graves' disease is an autoimmune condition, usually due to the antibodies overstimulating the thyroid to make hormones. But wouldn't say that stress causes Graves.
Now, we know hyperthyroidism can feel overwhelming, but once parents understand it, they realize it's very treatable.
And if you have concerns about your child's energy, behavior, or their thyroid labs, because sometimes those can be confusing, we're here to help. And thank you for joining us today on the Endo Kids Podcast, where little hormones meet big answers.
Thank you so much for joining us on the Endo Kids Podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.